Assalamualaikum. I hope everyone is fine. Everyone is doing great. Today I'm going to tell everyone something that is very shocking. I also realized that a long time after my clinical practice, I have been a doctor for more than 10 years now. The national drug of Bangladesh, everybody takes it regularly. It's an over-the-counter drug. The name is proton pump inhibitor. Proton pump inhibitor is a medication for gastritis or peptic ulcer disease. People keep on being on this drug for lifetime, and doctors also prescribe it. If a doctor knows basic microbiology, he should understand that proton pump inhibitor is not the treatment of peptic ulcer disease. It cannot be. It is included in the triple therapy. But let me tell you something. Those who are doctors, they will connect with me because I'm going to give a firm logic. Look, peptic ulcer disease is mainly caused by Helicobacter pylori, a gram-negative bacteria. This is urease producing. They produce urease and ultimately produce bicarbonate so that they can lower the gastric pH and colonize the gastric mucosa, most commonly the gastric antrum. But when a proton pump inhibitor is given, what a proton pump inhibitor does, it can be omeprazole, it can be esomeprazole, it can be dexlansoprazole or whatever it is. What proton pump inhibitor does, proton pump inhibitor, we all know, they also lower pH of gastric juice. So it's a simple logic. It's not a rocket science. It's a simple logic because long-term proton pump therapy will ultimately help Helicobacter pylori not only to colonize the gastric antrum, but then Helicobacter pylori is a flagellated mobile bacteria. They then will go to colonize the entire gastric mucosa. Pan-gastritis will ultimately occur. And through chronic pan-gastritis, there is risk for developing gastric carcinoma. Another important thing I have learned from reading some journals that before doing an endoscopy for dyspepsia, we should stop proton pump inhibitor at least 2 weeks prior to the procedure, because in that case gastric antrum will look normal, because Helicobacter pylori, which is a flagellated mobile bacteria, will ultimately transfer itself to another place and it will misguide the endoscopist and the diagnosis will be masked. So to get a proper diagnosis of peptic ulcer disease or antral erosion, we should stop proton pump inhibitor at least 2 weeks prior to the endoscopy, esophagoduodenoscopy to be perfect. Maximum 1 month proton pump inhibitor can be taken. It has many side effects. It can lead to osteoporosis, it can lead to iron deficiency anemia, it can lead to vitamin B12 deficiency, and it can also cause gastric carcinoma in long term. So do not take proton pump inhibitor lightly. Do not take it lifelong. If you have peptic ulcer disease, the doctor will prescribe you with in combination with triple therapy or quadruple therapy, and maximum it can be taken for 1 month, not more than that. Thank you very much.